Hi everyone, my name is Karrie Noonan. I am a clinical psychologist and director of the Death Literacy Institute here in Australia. I'm really honoured to be here and to be part of the event today. It looks like a great event, and I'm sorry I can't be there in person, and I'm sorry I can't be live with you today. So I'm recording my session for you. I'd really like to thank Dr. Madonna Baccaro, who invited me to be part of this event. Thank you so much, Madonna. And also thank you to the Philippine Society of Hospice and Palliative Medicine, the Philippine Academy of Family Physicians, Tondo Medical Center, Family and Community Medicine, Mary Johnson Hospital, Family and Community Medicine, and ARCHO Philippines. All of those organisations have done such an amazing job of putting together this event for World Hospice Day. I'm talking today about self-care, so let's get started. I wanted to start really with a bit of a definition of self-care and compassion. So all the way through my talk today, I do have all the references and all of the information if you want to look further into some of the references that I've used. But at the end of the talk, there is a reference list as well. This is work from Jason Mills here in Australia, and he defines self-care as self-care can be understood as the deliberate behaviours and actions taken to look after yourself. In a context of palliative care, self-care means a proactive and holistic approach to promoting personal health and well-being, to support professional and social roles. So interestingly, Jason and his colleagues did some research which showed that for palliative care professionals in particular, a very high percentage, like 86% of us regard self-care as incredibly important. The other thing that Jason and his colleagues have been really promoting is the use of self-care plans. And again, only 5% of people have used a self-care plan, and 70% though would consider them. And I wonder, for many of you today, whether or not either you have a self-care plan, something you've written down, or whether or not you would be in that 70% and consider using a self-care plan, but actually not have one. So there is a tool in Australia, and I'll share that with you in the reference list that you can get access to and have a look at that. But one of the things that I want to bring to light before we talk more about the individual side of things in terms of self-care is to talk about this triangle. I really like this triangle because what it helps us to do is to kind of look at the different levels of self-care and what they mean. So we know that self-care is, self is a big part of self-care. And yes, we need to manage ourselves and be thoughtful about our strengths and our abilities as a health professional, but also there are barriers and enablers in our workplaces that also impact on the way that we practice self-care. And I guess a lot of Jason's work and certainly modern work in self-care really does promote a holistic approach, a whole of organisation approach when it comes to self-care. But this is a resource that is used in Australia through Palliative Care Australia, and it's available for anyone to download. This is just bringing your attention to self-care planning and what that might look like. And Jason Mills and his colleagues talk about these 7 kind of aspects to the self-care planning process. So evaluating your current self-care and practice, reflecting on your personal values and motivation to self-care, which is a really important step because often we just go straight, like, busy professionals that we are, we go straight to the kind of, well, what am I going to do? But actually we know that if we reflect on our own values and if we reflect on what is important to us, then that actually helps with our motivation around self-care. So then to consider the social and professional roles. So looking at our social and our work-life harmony. And then the next one is identifying some of the stressors in particular that might impact on those self-care strategies, setting goals. So being that practical, what are the goals that I want to set myself in my workplace to be able to care for my well-being? And then looking at enlisting support. So that can be from management, peers, supervisors, and so on. And then, of course, committing to take action, which I think, is very closely related to how we use our teams, how we use our supervisors and supporters in the context of self-care. This is something that I would love for you to just do right now. Do a little self-assessment. Again, this is from the self-care planning tool from Palliative Care Australia. It's a little scale from 1 to 10, thinking about rarely practiced through to always practiced. Think about how regular your self-care is. If you want to share that on the chat box with other people right now, then please do. Start a conversation in the chat box around your self-care. So how regular is it? Have a think about how regularly when you're practicing the optimum amount, like the amount that you'd really like to be practicing, where is that on that scale? How much of a difference is there between what you're currently practicing and where you'd like to be? The next question is about how holistic and comprehensive your self-practice, your practice of self-care is. So from 1 to 10, thinking about I'm not practicing across domains of self-care versus all my self-care domains are addressed. So, thinking about, again, what's important to you in terms of the domains of self-care. That could be your physical, nutrition, the way you work on a team, time management, all kinds of things. And then finally, again, how self-compassionate are you towards your own suffering and vulnerability? So that's often a tough one, isn't it? For us as health professionals, we're used to thinking about, especially in palliative care, we're used to thinking about the suffering and the vulnerability of our patients and of the families of our patients. How self-compassionate are we towards our own suffering and vulnerability? Again, share it on chat if you feel comfortable. And what do you think about that? Is that a good little tool? Even just that, that's in the workbook from PCA, but, is that a good little tool just to kind of start you thinking about your own practice in terms of self-care? Okay, let's talk about some more strategies. Again, these are focused on kind of individual clinicians, and we're going to kind of start to stretch this idea out now. So one idea about looking after yourself is to develop a third space. So if home is the first space and work is the third space, the second space, then what's the third space in between these two places? So it could be the commute between your home and work and back again. So that third space becomes a place for you to slow down, listen to a podcast, listen to music, grab a coffee. It could be going to the gym before you go home. But it's so important to develop that extra space in between work and home so that you kind of, leave work in the space and leave home in the space that it's meant to be. So one of the things with working from home that has happened is that we've lost our third space. So the third space can sometimes be closing the door on your office. And we've literally, as part of COVID, had to really work hard to develop that third space. So it might mean that you close the computer lid, you walk out your office door, you shut the office door, you walk outside, you go for if you're able to walk around the yard, walk somewhere, do something to kind of move your body in a different way, move your mind in a different way, and just have that space. Don't walk into the kitchen. Don't go and walk into your bedroom or the living room without doing something in that third space first. So we've already talked about developing your own self-care plan, as per the example above, but you can download that plan and have a look at it and see how much it relates to you. Now, mindfulness is often used as a tool, but for many of us in the space, mindfulness is also a daily practice or part of our philosophy in working in healthcare. So if mindfulness, which is really about, practicing being thoughtful, being connected to the things that we're doing and saying, slowing down, deeply attending to the things that we're doing when we're doing them, whether that's being with a client, being with one of our students or a trainee, or talking with the boss, or eating, or drinking a coffee, or drinking some water, or going to the bathroom even. Okay. The other thing that can be really, there's a lot of evidence to show that peer support and social connection are a really important part of our self-care. Again, with COVID, our peer support and our social connections have been messed with considerably. So it's really kind of thinking about how do we connect to our peers, our friends outside of work. How do we make sure that we've got that balance between our work colleagues and our friends outside of work, so that we're not always thinking, talking, and conversing about work? As a psychologist, practice or clinical supervision is an important part of my work. I do it every month. I've been working as a psychologist over 25 years, and still every month, sometimes more than, sometimes twice a month if I need additional support, I will see my clinical supervisor, and I will also have peer supervision, and those two practices really provide a space for me to be able to reflect on what I'm doing and how I'm doing it. Clinical supervision should be a confidential space where you can really explore the things that are the things that you're doing every day in your practice, how it's going, what some of the clinical decisions you make and why you made them, and to be able to debrief when things don't go well, to be able to make plans for future episodes or future experiences around that issue or topic. And finally, awareness about system issues that contribute to your stress or your distress in a workplace is also really important. And this is, again, this kind of flows from practice and clinical supervision, I think. And that is, being aware of the clients and the conditions that trigger difficult memories or thoughts of our own. It might be a trigger to an old client, a patient that we've seen in the past where things didn't go so well. It might be difficult memories about a family member or about a recent loss that we've experienced, or being reminded of someone in our lives who's dying that we're still grieving for. The other thing are structural things like particular wards. So all of us have wards that we feel more comfortable in, or spaces that we feel more comfortable in. For some people, working in a clinic where They have the experience of being able to do one-on-one work with 4 walls around them. Feels much easier or safer than working on a ward where you're working with no walls, but you're working with a curtain, for example, where there's less privacy, and you're aware of the fact, for example, that you might be talking about sensitive things or sensitive issues with a family, or giving difficult or having a difficult conversation, a diagnosis or a prognosis conversation, when there is just a curtain around the bed. And of course, you know, our lives go on outside of work. Family and personal stressors also contribute to work stress, and they come into our lives at work, whether we like it or not. And this is where, I guess, flowing from that, I want to talk about moral injury and moral distress. But particularly, this has come up as an issue in COVID. And again, I've provided a resource here from Phoenix, Australia. They talk about moral distress as when situations arise that do not allow healthcare workers to deliver care in the way that they've been trained. And this may be associated with moral or ethical dissonance. So moral injury in particular refers to the psychological, social, and spiritual impact of events involving betrayal or transgression of one's own deeply held moral beliefs and values occurring in high-stakes situations. There are 2 kinds of moral transgressions that we tend to talk about when we talk about moral distress. And one is a transgression that involves people doing or failing to do things themselves, deliberately or unwittingly, and being exposed directly or indirectly to transgressions on the part of someone else. So bearing witness to grave humanity. So bearing witness to someone maybe not treating a patient as we know that they should be. It's really hard to think about. The issue with moral injury and moral distress is the impact of it. And what we know is the impact of the guilt and shame and lowered self-esteem, people feeling bad or damaged or unworthy. And also there's interpersonal outcomes as well. People feeling a loss of faith in other people, or avoidance of intimacy or lack of trust with authority figures. So if you work in a hierarchical system and you've seen a boss or a manager or someone act in a way that causes this kind of moral distress, it's a very difficult thing to repair. And then, of course, the existential and spiritual outcomes, including loss of faith in previous religious beliefs, or no longer wanting to believe in a just world. So we talked a little bit about kind of self-care and the things that you can do as an individual. We've talked about moral distress and moral injury and some of the impacts of that. I want to talk now a little bit about the workplace and the healthcare system. And this might feel a little bit like it's focused on managers and leaders, but we need to think about this as healthcare workers as well. But for all the managers and leaders who are listening right now, I really would encourage you to reflect upon, what are the things that you're doing to look after, to take that whole of organisation approach to employee care and well-being. And this includes from the board, from the highest level, from the board all the way down to, well, not down, but across to our cleaners, our food tech people, our orderlies, our volunteers, to our support staff on the ground. That when we think about self-care, it absolutely has to be an organisational approach. We can't just individualise self-care. So, and I love this quote from Nathalie Martinic, And I would encourage you to look up Nathalie's work. It's so great. And she's on Twitter in particular. Have a look at the kinds of things she's writing about. But I really like this quote because it sums up for me this belief in not individualizing the issue around self-care, taking on the responsibility to change a toxic workplace culture you didn't create is like the canary cleaning the coal mine so it can suffer in a prettier environment. It's challenging. Okay, so actions for leaders and managers. So again, this is coming from the lens of self-care starts in the organization and not the individual. So I'm going to start with some questions. How does your team deal with challenging issues such as conflict and disagreement? How does it deal with mental health if someone's not doing so well? How does it deal with burnout? Is burnout considered an individual issue? So we know that there is like an ICD definition of burnout. It's viewed as, the feeling of energy depletion or exhaustion, increased mental distance from one's job, feelings of feeling negative and feeling cynical about your day-to-day job, and reduced professional efficacy. So they're all things that at different times we might have felt. They might have been fleeting experiences that people have felt. Burnout tends to kind of refer to an ongoing experience of that. And it's very much about the occupational context, not the rest of life. So someone could be functioning very well in the rest of their life, but actually feel in relation to work that they just are exhausted. And again, this is an organizational concept. So there are certain actions that we can start to do in terms of thinking about culture. Here are a couple. This is not an extensive list by any means, but I picked some things that we've got some evidence around. So clear expectations with email and communications, for example. So when staff are not at work, are they offline? Or is there an expectation that your staff are answering emails after hours? Do you have an expectation on yourself that you should be doing your emails after work? I'll do all my clinical work in the hospital, and then I'll spend a couple of hours doing my emails and doing my admin and doing all of that. Meetings versus emails. And the worst case scenario for stress is having a meeting that is open-ended with no agenda, but so you don't know what to expect. Developing a culture of appreciation and support is incredibly important in the healthcare workspace in particular. So being able to say thank you, being able to use team meetings to make sure that everyone has a voice. What about being a trauma-informed workplace? And really being able to, but if that's new to you, please Google trauma-informed workplace and look up some of the practices. This is not stuff to I guess give lip service to. This is about deep cultural practice and kind of changing the way that we work and being able to look at psychologically safe workplaces where people can speak up without feeling belittled or disregarded for their opinions. So my question to you is how do you foster a psychologically safe environment? This is a 1 to 10 kind of scale, thinking about the 3 levels of psychologically safe workplaces. So you can see it goes from, we have a toxic, unsafe environment. This is where people hold back, spend a lot of time and energy on self-protection. So, that is such an energy zapping experience, isn't it? To have to self-protect. use all that energy to self-protect rather than being able to focus on working with our patients who are already vulnerable and possibly in pain or have other physical symptoms. So the next level is kind of thinking about psychological safety. Is not really kind of a glaring problem, but people do hold back ideas. And, there is some tension there around the way that we communicate and support each other, all the way through to kind of thinking about a safe place where people can collaborate across silos. So, in palliative care, we are often working across our teams, aren't we? Across different teams, in different wards, with different people. So, some take-home messages. I want to encourage you to think about self-care from a whole of organisation point of view, to think about culture being one key to providing a psychologically safe workplace. That self-care is more than providing training and resilience for your workers. That's fine. But if you're individualizing self-care, then you're potentially missing the systems in your workplace that are creating ongoing stress and distress for your workers. Consider practices that build on your strengths. And I talked about the idea of the third space, developing your own self-care plan, for example. And finally, probably one of the most important things in a busy hospital environment or healthcare environment, being able to set boundaries, including saying no, and being careful of FOMO, so the fear of missing out. So it's exciting to be involved in lots of different things all of the time, but saying no can also be part of the way that we reserve our energy for the work that we need to do, the way that we need to hold that energy that we need to have for our clients and the work that we need to do. That's also part of our self-care. I've got a few questions here. So for leaders, how are you creating a psychologically safe workplace? And how would you know if you are? For healthcare workers, what are the most helpful and most important ways you care for yourself? And how important are these practices? As in, how are you doing them? Are you turning up for them? For everyone, for all of you, for everyone listening, when was the last time you turned off your email notifications or left work on time or didn't go a whole day without having a break? That includes having something to eat, sitting down and having something to drink, sitting down with maybe the junior doctors or your senior or whoever and just kind of checking in, how are we going today? Or how many of you, when was the last time you had a bathroom break during your work day? Instead of turning up and spending all day looking after other people and asking people about their bathroom habits, as we often do in palliative care, when was the last time you attended to yours? And which goes to this, what are the poor behaviours that you need to unlearn so that you can be a leader for others, especially for your students or junior staff? This is the stuff of culture change. So thank you so much. That is my talk today. I'm really grateful that I've had this opportunity. I encourage you, if there's time, to go back to these questions and have a bit of a conversation together as a group about these questions and what might be relevant for you and your workplace. And all of this will be accessible. You can have my slides. I'll give them to the organisers. There's all links there to all of the resources that I've talked about today. So thank you so much. Have a great day, everyone. Bye.